Hey guys, this is Dr. Kristie. This video is for you today if, like me, you get pain right in the front or even off to the side here in these darn hip muscles, and you've tried stretching and that doesn't make it any better at all. Sleeping scrunched up on the side can make those hip flexors tighten right up, or even sleeping on the back with those legs bent up can cause some tightness in those hip flexors. Sitting on the computer or sitting in general also causes a lot of tightness. So like I said before, sometimes stretching doesn't actually work. And you can stretch a little bit and then it goes whoop, right back to feeling tight and uncomfortable. So today we're actually going to go over 3 exercises to help actually make it feel better for a longer period of time, hopefully permanently. The first 2 are actually using the nervous system to get things to calm down. So that darn brain is going to kick in. And the last one is a strengthening exercise to counteract this tightness in these muscles here. Okay, for the first exercise, we're actually going to do a very gentle, key emphasis word here, gentle, in through those hip flexor muscles. So you can lie right in bed. You don't even have to get out of bed to do this one, or on the floor if it's more comfortable for you. You're going to find the top of that hip bone, and you're going to take one hand and just kind of sink in a little bit. The other hand is going to come in just a little bit, and what I tend to do is find my belly button and take about 3 finger widths and go right there. You're just going to gently press in. You don't have to dig for dear life. If you're not sure if you're really on that hip flexor muscle, push in just a little, and then if you lift your knee, you should feel that muscle kind of pop right into your hand. Sometimes if you bring that knee in and out, you can feel that as well. And I actually happen to keep my Derma Edge right by my nightstand. One of my patients suggested doing that. So when I do this one, I tend to use the Derma Edge because it actually covers that whole area and it's easier on my hand to use. I'll link this below. This is the tool that I made. So either way, what you want to really focus on here, again, not digging in, but it's actually using the diaphragm to breathe. That helps to relax those muscles without pain or digging. So I'm just going to move this out of the way for a minute so you can see my stomach. So it's a nice deep breath in as you fill the belly up. And then exhale, let it go. So I'm going to put the Derma Edge back. So breathing in, exhale, and you can try to sink in just a touch more, but don't cause it to be painful. And I typically have people do this for about 4 or 5 breath cycles and then test by bringing that knee up towards you. And it should feel like you have a little bit more range of motion and less kind of pinchy in here. Okay, if you still feel some pinching or tightness after doing that first one, you can certainly repeat that cycle of breath. But then the second one I tend to add in is what we call a positional release. And it hopefully is as easy as it sounds. If you need to use a towel to help support your leg, if it's tough to lift it, by all means, please go ahead and do so. But you want to focus in on, okay, where is that tight, uncomfortable spot? And then I'm going to bring my leg up, and maybe it's a little tight and uncomfortable there, but as I actually come in further, the goal is to go, oh, hey, wait, that doesn't feel so bad. Now, it may not be straight up. You may have to actually bring that hip in a little bit or even out a little bit, or sometimes I actually need to rest my foot on my thigh and then play around with that position, rotating it in and out until I find that position of comfort, which for me today is right here. Now know that it might vary a little bit. Other days for me, it's actually rotated out a little bit. So it's okay if it changes. Once you find that position where now you go, oh my goodness, that's like a 0 or a 1, right? It doesn't really feel bad at all. Here comes the easy part. You get to just chill. And it can take up to 90 seconds is usually what I tell people. So focus, of course, in on your diaphragm breathing. Perfect time to practice that. So around 90 seconds, and then you're going to let it relax. You can shake it out. And then you're going to try to bring that knee in again. And hopefully, by this point in time, you go, oh, yeah, feels so good. Our last exercise can also be done in bed, yay! But this one is more about strengthening. So we're actually going to target those bum muscles to help loosen up those hip muscles. So when the butt muscles don't work, this gets tighter. When this is tighter, these don't work. It's a terrible vicious cycle. So one of my favorite ways to do this is what I call, and what you've probably heard of, called a frog bridge. So it's heels together and toes open, actually activates those glute muscles even more. You can keep your hands down by your side, press in a little bit. You can do just a tiny pelvic tuck if that feels okay. That actually helps to activate those glutes a touch more. Squeeze into those buns, and then you're gonna lift right on up, making sure you're not arching into anywhere. Pause for a couple seconds, and then with slow and controlled motion, come down, barely touch that butt, and come on up again, shooting for 15 to 20 repetitions. Thank you so much for watching today. If you would like to support me as well as reduce some pain and get rid of the appearance of that cellulite, click the link below to order your own Derma Edge, a device that I created and patented when I was going through the middle of Lyme disease in a lot of pain and needed a way to work on my own body. So the shape of the Derma Edge allows you to get all body parts in a gentle way. We're getting that fluid moving in between the layers, which helps you move better, helps get rid of that pain, and decreases that bumpiness of the cellulite. So make sure to click the link below to order your own.